Hello, everyone, and welcome back to Straumann Live. My name is Dr. Artemis Adkins, and I am your host today. And I have the pleasure, on behalf of the Straumann Group, to welcome Dr. Philippe Salah to the stage with me. Hi, welcome.
Thank you very much for receiving me today.
You are the founder of Dental Monitoring since
Yes, that's right.
2015, and before that, you were the founder of Harmony, a system for lingual brackets orthodontics.
You get it right.
Yes. Share with me a little bit about your history with dental monitoring.
So I founded Dental Monitoring in 2014. It was following the first venture that I did, as you said, in the lingual world, where we have seen lots of issue of treatment follow-up and treatment monitoring, and we wanted to solve the issue that the doctor were not capable of addressing. So we developed dental monitoring really to offer this solution to doctors to remotely follow patients and to provide better care.
Uh-huh.
Yes.
Now, when it comes to Dent2Go, yesterday I was walking around and checking out the exhibition hall, and you are showing Dent2Go inside the Straumann truck.
Yes.
I wanted you to share with me a little bit about what is Dent2Go and how is it linked to dental monitoring?
It's a very good question. A year ago, we have decided to bind dental monitoring with Straumann, and we have signed a very strong agreement allowing Straumann to leverage the artificial intelligence engine that have developed dental monitoring. And Dent2Go is really the fruit of strong work from the Straumann team and from the dental monitoring team to offer to the dental world this access to the dental monitoring AI engine.
Yes.
Yeah. So Dent2Go come from, I think, really the combined idea about the needs because we come from more an orthodontic background, and Straumann is more a global dentistry player, and we wanted to expand our market to the global dentistry, and Straumann was really the perfect fit with us, with this envy of innovation, envy of taking risk, and so on, which was for us very startup oriented, because at that time we were still a startup.
Yep. Your background is in biophysics.
Yes.
How did you end up in artificial intelligence?
Oh, it's a good question. I did a PhD in biophysics in 2000. I finished my PhD in 2007, and right after my PhD, I created Harmony after meeting a fantastic doctor at that time and really fall in love about the dental world. And I saw so much opportunity in this field that I did not know anything.
Yeah.
And I see so much opportunity in developing new things, adapting existing technology to this world that at that time don't really embrace technology. So we decided to create Harmony and then dental monitoring, and today I think we can say that it's a kind of nice success. Yeah.
I think you can say that too.
Yeah.
Okay, so talk to me a little bit about different tools available in the Dent2Go suite.
Yes.
I know it has,
So Dent2Go, let's show this visual. Dent2Go is globally a platform which is really patient oriented. It's based on multiple apps. There is an iPad app, a mobile app also, some device to scan and to do proper intro pictures, and also a doctor dashboard. Dent2Go is really a suite of software using the core artificial intelligence engine of dental monitoring and bringing this capacity to the Straumann world. And I will try to explain to you the different aspects of this venture, and there is 4 products that I will try to go more in detail.
So before you go into the 4 elements, I'm come from a clinical background, so I'm very curious about the patient journey related to Dent2Go. Will you kind of give our clinician audience a background?
The patient journey was actually the core of the work we did with Straumann. Is we wanted to challenge it a bit more, because today a patient arrives to a clinic and he comes with lots of preconceived idea. I've got some pain here, I need to ortho treatment, I need to replace a teeth, I need to do some cosmetic dentistry, and he comes with lots of preconceived idea what I need to do this for myself. But when then you have a discussion with a dental professional, very often the dental professional see other things.
Yes.
And we wanted to give a series of tools to the to the dentist or the specialist to be able to speak on a very fair base with the patient and to break this preconceived idea and basically to really provide the necessary cares to the patient.
Yes. I can attest to the idea that clinicians and patients, the relationship has significantly changed.
Yes.
When 2004 I graduated and Facebook became Facebook in 2004. And I remember part of our training had obviously always been about patient communication. But what happened with MySpace and Facebook and these tools and these apps and Google and all that, the patients completely shifted the way that they behave because they now look for information, not just from me.
This preconceived idea.
Yes,
exactly.
they come with, so I completely agree.
And so we tried to redesign the patient journey with a series of tools which start before the treatment, providing a pre-assessment, giving them the ability to visualize what will be the result of the treatment, which is, I will go more in detail with my smile. Then the follow-up of the treatment, monitoring the treatment, but not only at the clinic. And we wanted to bring it outside the clinic, which is really
cool.
something really new. And then, after treatment, what is happening? Relapse. Problems which can occur very quickly in most of the case. We wanted to give this ability to guard. It's why we call it Smile Guard.
So I'm curious, if you don't mind, this is a good time for us to go through the 4 elements. I want you to talk to our audience a little bit about what is vitals check as part of the...
So vital checks, it's really a unique and only one of this kind tool which basically provide to the patient a pre-assessment of his oral condition. So, and it's really designed to speak to the patient. It's not designed to speak to a dental professional. It's designed to speak to a patient. The words chosen are really oriented to the patient, that we break this preconceived idea. Then, this report, which is generated inside the clinic, even before it speaks to the doctor, is then a support of documentation for the doctor to speak to the patient. So the patient go from this initial scan, go to the chair, and then there is now an engaged conversation between the doctor based on facts and not anymore on preconceived idea. It's really the concept of vitals check. Then vital checks, if the doctor wants, this is on the cool aspect of the product. It can even fast track the process with bringing treatment recommendation with vital checks. For example, if his doctor is more an orthodontic clinic, then they will have orthodontic recommendation based on his own prerequisites. This is how we start the patient journey.
Very cool. So then the next offering in Dentigo is My Smile.
Yes.
And that's kind of continuing along the patient journey. So talk to me about My Smile and give our audience a sense of what it is.
My Smile is, as you understand, the first step is assessment, vitals check. But now the patient needs to select his treatment, need to make a decision, enlightened decision. And very often the problem is we see that the patient, they have to select, for example, if I go back to the ortho, they need to select a treatment based on typodonts or on picture of other patients.
Right.
This is quite hard to identify yourself based on
very
other picture or on typodonts. So we decided to use our artificial intelligence engine to provide an immediate, instant tool of simulating an appliance inside the mouth of the patient. So really go to the track after. It's really cool. You can make simulation for yourself.
Yes.
We just need to take a picture of you, and instantly you will have braces, aligner, clear braces, and far more. The second part of My Smile, you understand, it's not because you have an appliance inside the mouth that you have a treatment.
Right.
So you want to know more about what will happen for this treatment. So this is the second part of My Smile, is simulation of treatment. The doctor need to provide us with a treatment plan.
Yes.
And based on this treatment plan, we will instantly and accurately and clinically, respecting the prescription of the doctor, generate an updated smile, but very photorealistic updated smile inside the face of the patient. And this is pretty unique.
Very, very good.
Yeah.
Now talk to me about so for me, as I kind of understood what Dentigo was as I was researching, it sounds like it's basically building an extension of my practice into my patient's smartphone.
Kind of.
And give me a comment, give our audience a sense for how this is in terms of both the patient and the doctor experience with this, coming into now a patient's sort of smart technologies.
It's, yes, smartphones are everywhere. Everyone around us have smartphones. And kids from the age of 8 have smartphones now. And how do you speak? How do you engage patient? You engage speaking their language, using their tools. You should not be using something very exotic for them because they are not used to it and they want to stay in their comfort zone. So this was a natural tool to scan, to take photographs, and they are very used to it. Take selfie is not a new idea for them.
Surprising.
Okay, it's not. You probably take selfies. I take selfies, and so it was really speaking the language. Now to host all the software onto this device was also offering the ability to offer a far cheaper solution to the patient and to the dentist because this device is prepaid. You don't need very expensive alternative tool. So it was really the meaning of putting this AI engine directly on a very common device.
Very good. Now the next set of things I kind of want our audience to learn about is what are the highlights of Smile Guard as part of the Dentigo suite?
So Smile Guard is just coming after what the product we call monitoring. There is monitoring and then Smile Guard. Monitoring is the first product that you understand, assessing of the treatment. Then we've got this Smile product, which is providing a visualization of the treatment. Then the monitoring. The monitoring is what is happening outside the practice.
Right.
You've got tons of patients. You don't want that every time they come to your office, it's a surprise. You probably like surprise, but not in medical world. Not in medical world, okay? Me, I want to, when the patient arrive, you want them to be secure, you want the treatment outcome to happen, and so on. So it's exactly the extension of your office we have created through monitoring. Every clinical aspect is monitored and triggered to your clinic, and then your clinic can answer back to the patient with an appropriate answer. Then comes Smile Guard. Smile Guard is exactly the same concept. You have treated your patient, you want to continue after the treatment. You do the exact same thing. You want to see if there is no relapse for orthodontic treatment. You want to see if there is no gingival recession happening. You want to see if there is, for kids, hygiene problem which has been solved.
Right.
And so on. So this is keeping the patient in your patient health, engaged. And this is, I think, a key word you have said, engage your patient far more. This is all the purpose of Dentigo.
Very, very good. Now, I'm curious, since we have a few minutes, I'm curious about someone like you in your mind, creating innovative AI solutions. Where do you see the future of AI for healthcare? And of course, particularly dentistry.
I think we, as manufacturer, industrials, Straumann, see that today the patient asks for better care, but far more convenience. So this normally don't go together. You cannot have something very convenient where you go to the clinic of your doctor, but you don't see your doctor because then there is a lack of care normally.
Yes.
But with assistance of AI, now we can have the benefits of the both world, the convenience and the good care. There is a problem, you go to see your doctor.
Right.
There is no problem, everything is on track. You don't need to see your doctor. And I think everything around AI will be to enhance the capacity of the doctor far beyond the clinic.
Yes.
And to keep engaged again the patient into the treatment.
I actually want to talk to you about that for a minute as well. In terms of patient communication, this is so unique because engagement of the patient, traditionally speaking, in a traditional practice world, there's the recall notices, and we call to maintain engagement. We call and wish them their happy birthdays, and We give them patient education materials and things like that. But this is such a different way to maintain engagement from all those traditional tools that were available to us before. From a practice marketing and practice success perspective, how do you see this connected to the clinician becoming more successful?
It's a very good question, because it was a natural concern we had at the beginning when we developed dental monitoring and then Dent2Go, is what will be the perception of the care from the patient? Is it the right tool to communicate? So we did extensive study, and there is a publication which has been released a few months ago where a large-scale interview has been done on dental monitoring patient user, and what was the key element why they what they like in their clinics. And they always say, and it's a very high percentage, say, we appreciate the deep contact and engagement with our doctors.
Yes.
Because you have to understand, this system creates a direct link between the clinic and the patient, and the message are as often as the dentist or the specialist wants, can be every week. The treatment aspect are really directly connected to the patient, and again, not anymore a surprise. It's not in 2 months when I see you again, I will see what happened.
Hope it works out. Yeah.
Yeah. It's on a weekly basis at least.
Talk to me as a clinician. I'm always curious about the staff-related training and changes to my normal workflows and operations in the practice. Talk to me about how easy it is for this to be integrated into the practice.
This has changed a lot in the course of the history of dental monitoring, and I think one of the true benefits of partnering with Straumann was bringing to us this experience of how easy should be the process to be really integrated into a dental clinic. So Straumann have worked a lot in terms of ergonomy, in terms of education process, and so on. And we have made that everything is online, training is online. You can request product specialists to come to your clinic for more education, but you don't really need it. It can be kind of plug and play. And this, I think, is one of the core benefits that we have learned with working with Straumann.
What can my team do? So I obviously, as a clinician, I spend my time best with the patient.
Yeah.
So during the day when feedback is coming back to the practice through dental monitoring and through Dent2Go, how easy is it for my staff to take this up? And what's available for them to support?
The communication organized inside the platform is either automated or either on demand. So for a selected number of subjects, you can have automated communication with the patient. Like, I lost a button, the system will say to the patient, stop wearing your elastic until the next appointment. This, you don't really require a staff intervention.
Right.
It can be automated. If the system trigger a more specific clinical question, then it will be an on-demand thing, where on the system you will be able to rank them. This my staff can manage because I know my staff is enough skilled to manage it, or this require doctor intervention. So the system is really a multiple level of settings, with allowing you to really drive the monitoring with lots of comfort and confidence.
Very nice.
Yeah.
Now, any last-minute thoughts from you in terms of when it comes to, for example, Dent2Go and the uptake of Dent2Go? You mentioned education being one of the parameters you guys considered heavily. Will you speak to our audience a little bit about how they engage for Dent2Go? How do they come on, and how do they expect and receive some education from you?
This is again one of the core advantages of working with such company like Straumann, truly organized. I think to engage to Dent2Go first, for the one who are in the ITS, this big event, go to the track.
Right.
There is this Straumann track dedicated to Dent2Go, and you will get a live demo. It's super cool to see. Explanation with experts using the product, and with doctors. We've got literally tons of doctors using the product which are there to explain. And for all which are listening, just contact your local rep, and they will drive you to the product specialist of Dent2Go.
Very good.
It's quite easy to start.
So my last question before we close. As a general practitioner, I often valued the relationship between my staff, myself, and my patients. And it's very similar in orthodontic practices, where the relationship, patient relationship base is throughout that treatment cycle. It's the paramount sort of pinnacle of the success of the treatment is related to relationships. I see this dental monitoring and Dent2Go as a really excellent tool for relationship building and trust building and communication building, where anything at any moment there is access and ease.
There is access and engagement. You
I want
say
you to
this
talk to
exact
me, yeah.
word, which is engaging the patient far more into this treatment. Imagine you're a patient and you've got a debonding braces or an aligner not fitting,
Yep.
and you receive instantly from your doctors a message say, "Hey, you've got these little bugs. Don't worry, we have an eyes on it, and we will fix it. But meanwhile, do this." Wow,
Right.
this is so instant. This is so our world.
Yep.
This is so much our world, how we live today.
And for the at least the younger patient base who is getting into clear aligners as far as treatment goes, they are so used to. We were talking yesterday with some of our teams about, these people are born now
Yeah.
with gadgets in their
I'm
hands.
my kid is 4. I'm trying to not give them smartphones.
I am going to lose this battle. I have a 4.5-year-old. There's no way I'm going to win this. But they're born with these things already there. So for them to engage the office, I can just imagine let's say a 15-year-old to 18-year-old calling the office versus getting into their app.
Instant
and
chat.
I can't. Yes, there is no competition.
There is no.
They're going to go in there before they pick up that telephone.
They use a Dent2Go instant chat system. They get the clinic gets a notification of someone speaking to them, a patient speaking to them. They can answer when they want, no rush.
Yep.
But at least there is this secure,
Yes.
regulated
That's right.
path of communication.
Right.
It's not WhatsApp,
Right.
which is not really
Yes.
regulated.
Yes.
Okay, it's really
HIPAA.
regulated
Yes.
path of communication, and I think this is very crucial for the success of a modern clinic today.
I completely agree with you. And on that note, Dr. Salah, thank you
so
so
much for this
much
interview.
for
It
spending
was
some
nice.
time with us. On behalf of Straumann Group, I'd like to thank Dr. Salah and invite you to go to the Straumann truck and check out Dent2Go. From coming to you live from IDS, I will see you next time. Thank you so much.
Thank you.